Hello, and thank you for joining this Bolder Healthier Winter webinar series on respiratory health and smoking cessation. My name's Rachel Emmerich, and I'm the Senior Programme Officer for Smoking Cessation at Birmingham City Council's Public Health team. The aim of this session is to outline smoking cessation and respiratory health, including why smoking is harmful to respiratory health, elaborate on the benefits of quitting smoking, and explore what support is available to Birmingham residents. So firstly, what is tobacco and smoking? So tobacco is made from the leaves of tobacco plants and it contains nicotine, which is an addictive substance. Smoking is the action of inhaling and exhaling tobacco smoke via cigarettes, cigars, pipes, etc. When you smoke, tobacco in cigarettes, cigars, and pipes is absorbed and they contain cancer-causing chemicals that affect your health. Chewing tobacco or spit tobacco can be chewed, inhaled, or consumed orally, and these products have particular cultural significance in some South Asian and African communities. Tobacco use is one of the most significant causes of health inequalities, and there's a strong link between cigarette smoking and socio-economic groups. Smoking has been identified as the single biggest cause of inequality in death rates between rich and poor in the UK. Smoking accounts for over half of the difference in risk of premature death between social classes. So why is smoking harmful? So as we've already said, it's one of the biggest causes of deaths and illnesses in the UK. Around 76,000 people in the UK die from smoking every year, with more living with debilitating smoking-related illnesses. Smoking increases your risk of developing more than 50 serious health conditions. Some may be fatal, and others can cause irreversible long-term damage to your health. So tobacco smoke contains over 4,000 chemicals. So many are listed there in that diagram. And when you smoke, all of these chemicals mix together and form a sticky tar. The tar sticks to clothing, skin, and to the cilia, which are the tiny hairs that line the inside of your lungs. The cilia help clean out the dirt and germs from your lungs, and if they're covered in this tar, they can't do their job properly. And the germs and chemicals in the dirt can stay in your lungs, which can then go on to cause diseases. Acetone, which is on the diagram here, is also a paint stripper. It's used in nail polish remover, as well as a household cleaner. Yes, just all the list of chemicals involved just have other uses. They're quite harmful uses, insecticide, rocket fuel. So secondhand smoke. So it's been estimated that domestic exposure to secondhand smoke in the UK causes around 2,700 deaths in people aged between 20 and 63 years, and a further 8,000 deaths a year amongst people aged 65 years and older. A child who's exposed to passive smoking is at increased risk of developing chest infections, meningitis, a persistent cough, and if they have asthma, their symptoms will sometimes get worse. There are also long-term effects that can be cyclical in nature, such as a child who lives with a smoker is twice as likely to become a smoker themselves. The increased risk to pets, potentially swallowing cigarette butts and other tobacco-causing products. The nicotine is poisonous, so it can be fatal. So then on to smokeless tobacco and why it's harmful. So it can lead to nicotine addiction, cause cancer of the mouth, esophagus, pancreas. It's associated with other diseases of the mouth and can increase risks for early delivery and stillbirth when used during pregnancy. So the benefits of quitting, so increased lifespan. So ASH have reported that 2 major longitudinal studies have demonstrated the benefits of stopping smoking at an early age. The 50-year follow-up of the study of British doctors revealed that if smokers quit before the age of 30, they can avoid more than 90% of the smoking attributable risk of lung cancer. So stopping smoking increases life expectancy, and improves health status, such as reduced risk of heart disease, stroke, vascular disease, respiratory diseases, and certain cancers. There'll also be an improvement of symptoms in COPD, and it has a knock-on effect on physical and mental well-being. You can also save money. Smoking's expensive, and as prices continue to rise, the more money you save by quitting smoking. Smoking harms your unborn baby, and stopping smoking will reduce the risk of harm during pregnancy. So then, in terms of the wider benefits of quitting, over 1.5 million people in England require social care support because of smoking. Every year, local authorities in England spend approximately 1.2 billion on home and residential social care support caused by smoking. That's the equivalent to 8% of all local authority spending on home and residential social care support for adults in England. Smoking is estimated to cost the NHS 2.5 billion every year, which is equivalent to 2% of the NHS health service budget. So smoking prevalence amongst adults in Birmingham was 13.6% in 2021. There's never been a better time to quit smoking to protect you and others around you and reduce the pressures on the NHS. Smoking attributable deaths account for around half of all deaths across Birmingham every year. Quitting smoking rapidly reduces your risks of other health problems, such as heart problems, strokes, and cancer. It's never too late to quit smoking, and with the right support, you're 3 times more likely to quit for good. So then this is just covering what was just discussed in terms of smoking in Birmingham. And then the plans for Birmingham. So the aim of the Stop Smoking service is to maximise the number of smokers accessing the service and quitting long term, therefore contributing to the reducing of smoking prevalence in Birmingham. So then we've got the 10-year plan, A Bolder, Healthier Future for the people of Birmingham and Solihull, which sets out the local 5 to 10-year commitment that all health and social care professionals will complete basic e-learning for behaviour change, and those in clinical contact roles completing any additional training on brief advice for smoking cessation. So the aim of the strategy is to improve life expectancy for the people of Birmingham and Solihull. So then here we have the diagram, which just shows the estimated costs that smoking has to Birmingham. So that covers the 16.1% of adults that smoke in Birmingham, and then the estimated kind of spend on smoking, as well as the impacts of smoking on productivity, the healthcare costs due to smoking, and the fire costs due to smoking as well. So it says here about 55 smoking-related fires are attended by fire and rescue services each year in Birmingham. And 11.9 million that's the smoking materials are a major contributor to accidental fires. Smoking-related fires result in annual losses of 11.9 million. So then smoking in the workplace, so it negatively affects the earnings and the employment prospects. In 2019, 23.4% of adults in routine and manual occupations smoked, compared with 9.3% in managerial professions and occupations. So the smoking-related inequalities. So smoking is one of the main causes of health inequalities in England. 1 in 5 adults smoke. The most deprived groups have the highest smoking rates, for example, homeless people, those entering prison, 11 to 16-year-olds with a mental health disorder. And then we have the additional impact on Birmingham and Solihull communities. Approximately 60,000 smoking households live in poverty. Deaths due to smoking in Birmingham are higher than those of the Midlands and England. So barriers people may face when trying to quit. So that's the nicotine withdrawal, the craving triggers, handling stress, managing mood, slips and relapses, as well as conscious of weight gain and appetite. So it's working to overcome those barriers. So in terms of the nicotine addiction, there's nicotine replacement therapy. It works by replacing some of the nicotine provided by cigarettes, allowing smokers to slowly reduce their dependence on nicotine. Within the services we have in Birmingham, we always recommend combining NRT medications, as it's more effective than just using one. So, for example, that would be using a patch and gum, not just patches alone. Craving and triggers, so they can occur after quitting, and it's just about the behavioural support element and remembering that quitting is best for your health. You can plan ahead so you can handle the cravings, distracting yourself from the cravings by doing mindfulness exercises, and understanding and identifying the triggers. Is it places, people, situations? And then in terms of handling the stress, so smoking isn't long-term stress relief. Instead of smoking a cigarette, consider taking a walk, doing mindfulness exercises. Nicotine addiction causes stress due to the possible withdrawal, hence the nicotine replacement therapy. So then in terms of managing mood, especially when you quit smoking, so focusing on uplifting your mood by staying active, structure your day to keep busy and get support when needed. And then for slips and relapses, so it's using the NRT, potentially starting your quit journey again. And then in terms of weight gain and appetite, eating mindfully and being physically active. So then in terms of the e-cigs and vapes, so we have the Tobacco Control Alliance. So the messaging is, if you don't smoke, don't vape. Vapes do form part of our community stop smoking service, but that's for people that already smoke. Hence, if you don't smoke, you don't vape. If you've never smoked, don't use e-cigarettes. Then we have smoking in the combi model. So that's the behavioural support element, which you can access through the Birmingham Stop Smoking service, which I'll talk more about in a moment. So what support's available in Birmingham? So we have the Quit with Bella app. It is free to download. It's available to Birmingham residents. You can access the app. You can get nicotine replacement therapy through the app. You just need to download the app and start your quit journey. Bella's quite good because it's available 24/7. It's artificial intelligence, so you can have a chat with Bella. I do have a video just to show you now.
Bella is your personal stop smoking coach. Giving up smoking can be an emotional and isolating journey. The stress can feel overwhelming when the cravings are strong. The temptation can be great. So reach for Bella. Built on the evidence base and knowledge from hundreds of experts who have helped thousands of people quit smoking, Bella is the world's first artificial intelligence-powered stop smoking coach. No graphics to navigate, no graphs to understand. Just a personalised conversation with a trained expert. Quit with Bella today.
So then in terms of what other support's available in Birmingham, so we also have the Birmingham Community Stop Smoking Service that's currently delivered by over 100 GPs and pharmacies. If you just Google Birmingham Stop Smoking Service, it will come up with the webpage and you can put your postcode in and find your nearest GP or pharmacy stop smoking service. For context, what that service involves, it's a 12-week programme. Delivered by the pharmacies or GPs. It consists of behavioural support, so that's kind of covering the barriers that were mentioned earlier in terms of the nicotine cravings, managing stress, managing triggers, and then alongside that is the combined nicotine replacement therapy, as well as vapes, so e-cigarettes. But they'll all be discussed at your appointment in terms of what option is best for you. We also have the Stoptober campaigns, which run in the month of October, as well as No Smoking Day in March. The NHS also have a variety of services. They also have their own smoking app, and if you Google NHS smoking, you can also find your nearest provider of the service there. So that's it in terms of the smoking portion of this webinar. But I do have another video to share, that's kindly been provided to us by the Targeted Lung Health Check team. So the Targeted Lung Health Check team, Dr. Babu Naidu and the Targeted Lung Health Check team have kindly provided us with this video presentation. It's on smokeless tobacco and the Targeted Lung Health Check program. Dr. Babu Naidu is the clinical lead for targeted lung health checks for Birmingham and Solihull. And for context, the Targeted Lung Health Check programme is a new and groundbreaking flagship programme of work in England, which will contribute to the ambition of the NHS long-term plan to improve early diagnosis and survival for those diagnosed with cancer. The Targeted Lung Health Check programme targets those most at risk of lung cancer and works with integrated care boards who have some of the highest rates of mortality from lung cancer. The programme will work initially, it's 10 projects, but then expand to other integrated care boards across England to deliver the programme. It's expected that this programme will run nationally, covering all areas of England from 2024 onwards. People aged over 55 years and under 75 years old that have ever smoked will be invited to a free lung health check. The Targeted Lung Health Check programme has been running since 2022, focusing on the east locality of Birmingham due to high deprivation and greater prevalence of smokers. Since then, the Targeted Lung Health Check Birmingham has sent over 22,000 invitations and performed 614 scans. The Targeted Lung Health Check programme saves lives. So I'll now pass over to Dr. Babu Naidu's presentation. Thank you very much.
Hi, my name's Babu. I was born and raised in Birmingham. I'm a lung surgeon and educator and a resident of this great city, and that's why I care so much about the lives of people living here. So unfortunately, I've seen an increase in tobacco-related illnesses over the past few years. Many people are unaware of the risks of smokeless tobacco and where to get support. I want to empower everyone to make informed decisions about their lives by sharing some information with you. This presentation is for everyone, so please share with your friends and family so together we can all lead a healthier and happier life. So what is smokeless tobacco? It's a product you chew or dissolve in the mouth instead of smoking, and there are many types such as snuff, snus, beetle, pan, cut. It's used in Birmingham by many different communities, but mostly by Bangladeshi, Pakistani, Polish, and Somali. And while smokeless tobacco may be used for cultural reasons, there are many harmful effects that people should be aware of so they can make an informed choice. I want to burst a few of the myths around smokeless tobacco. The first thing is it is as harmful as a cigarette, and in certain circumstances can actually be more harmful than cigarettes. It contains nicotine, so it's addictive. And because it's taken by mouth, it increases the risk of dental disease and cancer in the mouth. And just like cigarettes, it increases the risk of a heart attack and stroke, as well as reducing fertility. Now, in pregnant women, it increases the risk of an early delivery and a stillbirth. And because it may contain harmful metals such as arsenic, lead, nickel, and mercury, it's extremely harmful for children. And when you take smokeless tobacco, it makes it more difficult to treat cancer. Some people think it's a good way to stop smoking. This isn't true, because there's no safe level of tobacco use. But remember, it's never too late to stop. And you can access support from your pharmacist, GP, social worker, dentist, or probation officer. Using the local stop smoking services means that you're 3 times more likely to quit for good. And you can find these by clicking on the link, and support is provided either face-to-face or by phone. And Birmingham residents can also use the Quit with Bella app. So what can you expect from this? Well, it's delivered by professionals who give free expert advice, support, and encouragement to help you quit smoking and stop for good. The second initiative I want to tell you about is the targeted lung health check. Now, unfortunately, there are often no signs in the early stages of lung cancer. And that's why 7 in 10 people in this country get diagnosed too late to be cured. We want to change that, to find problems early, often before anything is wrong, at a time when treatment is far more successful. Therefore, we can save many more lives. And those eligible are aged between 55 to 74 who have ever smoked or are currently smoking. We want to check your lungs are working well. So if you are sent an invitation letter through the post, please take up the offer. If you want more information, please call us or email us, or you can scan this QR code and fill in a form, and we'll get back to you. Thank you for your attention and patience, and I wish you all a good day.